Hello, I'm Dr. Felice, and today we are going to be going over how to decrease pain and increase mobility in the mid-back after an acute injury. So I'm not sure if this has happened to you where maybe you sneeze or you tried to lift something and all of a sudden it just feels like your back seizes like right around the middle. So these exercises are going to help with this. And always remember that if you do have anything specifically going on, this does not substitute medical care. Reach out to your medical doctor or physical therapist for a proper evaluation. So the first thing we want to do is self-assess, meaning can I actually see how much range of motion I have in the area that I'm having discomfort in. So one of the things that I like to test is keeping your arms behind your head, and sometimes this in and of itself could be uncomfortable, and just taking 3 deep breaths. Are you able to take a full breath with your arms being in this position? If this is too uncomfortable, you can keep your arms here and simply take a breath. Notice if you're able to inhale fully, and if not, this is a good place for you to start. It's just with like deep breaths. Inhaling, allowing the rib cage to expand outwardly, and then as you exhale, bringing it in. From here, you're going to look at rotation. So again, my arms are going to either be across my chest or behind my head. So we'll start here, and we want to rotate as far as we can, keeping the feet about hip width apart. Rotate as far as we can to the right and then to the left. And I want you to notice if you see a difference in my own spine. So I'm going to go all the way to the right as far as I can, and you'll feel some hip movement happening as well. And then I'm going to the left, and I'm actually a little bit stiff here. See if you can notice that. Right, and then now left. So I have limited rotation to my left, and this is a nice way for you to be able to check that. Let me show you a different assessment. So from here, you can also check the mobility of each of the spine. So we looked at rotation. Now we're going to look at flexion and extension, meaning our ability to go forward and backward. You want to assume a tabletop position. So your hands are going to be right underneath your shoulders, knees are going to be underneath your hips. As you inhale, you want to try to arch your back, and then on the exhale, very slowly bringing your chin to your chest, tucking the tailbone under, and trying to articulate, meaning try to move each of the vertebrae one at a time. Exhale at the top here, and then inhale. Slowly come out of that movement, almost like you're unraveling, and then again. So this is known as cat and cow. If you've done yoga, you've probably have seen this, but this is a nice way to kind of see, do you have limited motion in flexion and extension of the spine? So you can start with about 5 reps of those and see how they feel. They should not be painful. All right, so now we're going to go over some exercises to help improve mobility. So now that you've self-assessed, and you can do those check-ins after doing a few reps of these exercises. So the first one is going to be a thoracic extension over a foam roller. So you're going to have your foam roller here, and then arms are going to be behind your head. And I would recommend starting with the hips on the ground, and you're going to go ahead and allow your back to go into an extended position. And you almost want to use the foam roller as kind of like a fulcrum, right, or like a stop, and then you want to move the vertebra above it. So right here I feel actually a little bit of restriction, so I'm not going to go too far back. And then if I wanted more pressure, I can lift my hips up and then move into extension that way. So make sure that you're doing this very slowly and you're breathing, and then you can actually roll back and forth on the foam roller since you're already there to loosen up the tissue, and then kind of coming back into that micro extension to improve your mobility. All right, so the next exercise we're going to do is called open book, and I like using a foam roller to allow myself to bring the knee right over it, and you can use it to push into the knee to create a little bit more recruitment through your core. So you want to lay your head on the side here. Arms are going to be extended. Gently pushing your knee into the foam roller. You're going to go ahead and rotate, trying to reach the shoulder blade to the ground, and then kind of bring that arm out while you're pushing your knee into your foam roller. You should feel a nice stretch through here and rotation through the T-spine. So let's say you don't have this range of motion. You want to come here and maybe just go shy of the discomfort. Exhale, and then inhale on the way back in. All right, so the next exercise also for increasing mobility and decreasing pain of the T-spine is going to be a quadruped, meaning on your hands and knees, T-spine rotation. So hands are going to be underneath the shoulders, knees are going to be right underneath your hips, and you want to place your hand behind your head. You're going to take a deep inhale, and as you exhale, rotate, bringing the chest to open up on the right side. And you can do about 3 to 5 reps on each side, and then repeat on the left side. Inhaling as you come down, exhaling to rotate. And where you feel that restriction, use your arm to push into the ground, and then rotate. Start with 3 to 5 sets on each side, and you can progress that to 2 sets of 10. This exercise we're going to do is called thread the needle. So what you want to do here, and you can have a foam roller or choose not to use one. Either way, you're going to bring the arm all the way through and then come back in. So notice as I'm doing this, I want to touch my shoulder to the ground. So I'll do about 3 on this side. You can do anywhere between 3 to 5 repetitions, and then try that on the other side. Take a deep breath, inhale, and then rotate, 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 touching that shoulder blade to the ground. Notice my hips do stay up as you're doing this. You could come down a little bit more. You'll get a little bit more of a back stretch that way, but a lot of things being moved here. That's thread the needle to increase T-spine mobility. All right, so this last exercise is a little bit more complex, but it's a nice way to load the body. You're in a half kneeling position. This is called a half kneeling T-spine rotation. I know it's a mouthful, but it's actually a part of what's called a Turkish getup, and I have a different video that I can show you, and I'll put a link to that on this video. But what you want to do here, so this is a kettlebell, and initially if you don't want to use the kettlebell, you can do this without weight. So you want to press the kettlebell overhead, and simply just holding here, you want to go ahead and slide the hand down and then weight bear on your hand. And you're going to hold that position for 2 seconds and then come out of it, hinge, and come back to this. So there's rotation. You want to slide that hand down, hold for 2 seconds, hinge, and then come out of that. So you want to do this for about 3 to 5 repetitions. Notice how my elbow is straight. I want to rotate, slide that hand down, weight bear over my left hand, looking up at the kettlebell the entire time. And then I'll do just one more. And that's your half kneeling T-spine windmill.